Good afternoon and welcome to Ask the Doctor. It's a community conversation here on Whitewater Community Television's WGTV Channel 11. I'm Eric Marsh, Executive Director of WCTV. And once again this week, as with last week, I'm joined by Dr. David Jetmore, Wayne County Health Officer. I got it this time?
You nailed it. I'm really impressed.
See, if we do this long enough, I'll get it right every time. And Dr. Thomas Huth, who is Vice President of Medical Affairs for Reid Health. Gentlemen, I know that it has been a busy week. Thank you both for, again, taking some time to do this.
It's a pleasure to be here.
We're going to start with, we have a guest on the phone, Christine Stenson, who is the Executive Director of the Wayne County Health Department. Christine, can you hear me?
I can hear you. Thank you for having me.
Glad that you were able to join us. You and Dr. Jetmore kind of actually get the first question, and it really came from a press release that you all put out on April 1st. I'll just read a part of it. As part of a case investigation, the Wayne County Health Department was informed of an individual in a neighboring county that tested positive for COVID-19. The individual attended an event in Wayne County on March 14th, 2020. The event was attended by 200 other people. Since we have been notified outside of the 14-day quarantine period, there is little case contact we can do. The question that was asked by a number of members of the community when that press release got posted is, if you were willing to tell us that there was an event and it had 200 people in it, why did you all choose not to say what the event was? And I think that's a question that was asked a lot, particularly on social media. And as opposed to having people speculate the answer, I thought I'd bring you both in and let you answer that question. So why would you tell us that there was an event, tell us that there were 200 people, but not tell us the event?
Right, and it's a fair question. Dr. Jetmore and myself went back and forth on, do we release the name of the event? That wasn't the main purpose of putting that in the press release. It was to illustrate why we do social distancing and why we had to go to limiting all gatherings like this. So we were already outside of that quarantine period. If we were inside that quarantine, our press release and our case investigation would have been far different. But since we were outside of that, we felt, you know what, the main focus isn't where the event was. The main focus was to let people understand why we're doing this social distancing.
Okay. Anything you want to add to that, Dr. Jetmore?
I think that's an excellent answer. We found this out 16 days after people had gathered for this event, and it was less than 200. We found out it was 94 people, but nonetheless, the people that held that event were doing it within the guidelines that had been set forth at the time. They did nothing wrong. And since it was past the quarantine period, as Christine said, we didn't feel the need to name the place where they were.
Because things like that get out and it creates speculation about what the event was and some anxiety for people, did that come into play in your decision at all? Once I'm sure you heard some of the speculation that was out there. People were naming various events out there.
You want to answer that, Christine? Or?
Right, and I stand by us not, releasing the name of the event. Mm-hmm. But you know what? If we would have released the name of the event, I would stand by that too. It was a flip of the coin whether we did it or didn't. We created anxiety because we didn't release the name. We would have created anxiety had we released the name of the event. It's just a stressful and anxiety-riddled time that we're facing in our community. And Dr. Jetmore and myself try our very best to get out honest and worthy information to the public, stuff that we feel like that they need to know, and not try to sensationalize it. We just want to get factual information out to the public as quickly as we can to them. So, should we have released the name? Maybe. Should we have not? Maybe. I could see it either way.
Okay. Christine, thank you for joining us. Before I let you go, is there anything, since we've got you on the line, that you would like to tell the community right now since you're here?
Sure. stay at home. There still is a stay-at-home order by Governor Holcomb. He is going to be speaking at 2:30. We fully expect that he's going to extend this, and we are very supportive if he does extend this into at least the beginning of May, if not into the middle of May. We know that the COVID virus is scheduled to peak toward the end of April or mid-May. So stay home. Only go out for essential services, grocery stores, to your pharmacy, and to any doctor's appointments. But other than that, stay home. Kids should be home. They shouldn't be out running around with friends. We drive around the community. We see neighborhood basketball games going on. This is how the vicious cycle of this virus is going. We need everyone to socially, physically distance themselves from each other, hunker down, and let's get this ridden out with as few cases as we possibly can.
Okay.
Don't forget to wash your hands.
Christine Stenson, Executive Director, Wayne County Health Department. Appreciate the time this afternoon.
Thank you very much.
This is Ask the Doctors, so we have been gathering questions. People have, they were excited about last week's show, that they were able to get some answers from you all. We announced that you all had agreed to come back, and we've been getting questions. So, Ryan, what's the first one up? We originally heard that only those who are sick should wear cloth masks. Now there are sources suggesting everyone wear them while they are out. What is the current protocol? And if it has changed, what is the reasoning? Dr. Huth?
Well, this is a question that has evolved over time, or the answer to which has evolved over time. And I think as it stands today, the Centers for Disease Control is still suggesting that out in the general public, the only people who really need to consider covering their mouth and nose are those who have cough or sneezes and such like. In fact, I heard the Surgeon General, Dr. Jerry Adams, who has an Indiana connection, say just about 4 days ago that there's some evidence that those people who wear masks a lot actually touch their face more. And I've noticed this around the hospital where we're wearing masks a whole lot more, that people are adjusting their mask and this kind of thing. And so I think the jury's maybe a little bit out on the value of the general public wearing masks, but I think we all just need to pay attention to whether this is something that, as more information comes in, and the experts at the national and state level may change their opinion about the utility of wearing masks. But as it stands today, I don't wear a mask in public, but I do try to make sure that I maintain the social distancing. And I appreciate it when I see other people wearing masks, though, because I will take it for granted that they're trying to do the right thing to protect me and others from any symptoms they might have. And so I would never give anybody a hard time about wearing a mask. But I choose not to do that myself at the moment.
I think the mayor of Los Angeles is suggesting that people there wear them. I know the national media has been speculating for a couple of days that something like this would come down from the federal government.
Well, my view on masks, and we've talked about this from the beginning, Eric, has changed dramatically. And it's, the observation, and a lot of it's due to testing, of how well South Korea and Singapore and Japan have come through this. They're mask-wearing societies. There's no stigma of wearing a mask anywhere in those countries. And everybody put on a mask when the coronavirus hit, and they had a very their society. They had much less impact from the disease than non-mask-wearing societies like Italy and Spain. The main problem with the mask is there aren't enough masks, Eric. The people who need the mask the most are caregivers, and they're trying to find masks in New York for people who are in rooms caring for COVID-19 patients. So, I think in an ideal world, if everybody that was taking care of coronavirus patients, all our first responders had masks, then I think it would not be a bad idea at all for everybody in America to put on a mask. The one caveat is, I think, when you put on a mask, as Dr. Huth alluded to, I mean, this has not solved the whole problem. I mean, I don't want people to get a false sense of security that they can walk around with a mask and they're bulletproof from the coronavirus, because they're not.
Or spreading it. for
Or
that
spreading
matter.
it.
Okay. Next question up. I'm not clear as to if you can or should not use ibuprofen if you think you might have COVID-19. Could you lend some advice? So there has been some conversation as to what you can take if you're not feeling well and if you have a fever.
I think that we're still recommending to try to stick with Tylenol for pain and fever and avoid the anti-inflammatory type drugs. Ibuprofen is one of which. That comes from some early indications from China and elsewhere that patients who were on the anti-inflammatories did not do as well as those who avoided it, and there's a theoretical mechanism of action in terms of the life cycle of the virus, that it might augment the viral replication. But I don't think we really know for sure, and this is another topic that could change over time, but I think that the current recommendation still is to avoid the anti-inflammatories, and it's not just ibuprofen. That happens to be the one that's most commonly available over the counter, and try to stick with acetaminophen or Tylenol as long as you can tolerate that. Now, the exception to that would be people who take low doses of aspirin for their heart disease and such, or people who are on anti-inflammatory medications for their arthritic conditions. They need to follow their doctor's advice on what to do with their medicines and shouldn't just unilaterally stop them.
I think it was the French that reported first that, that ibuprofen seemed to make their COVID-19 patients worse, but then somebody did a very small study saying there was no difference. But I agree with Dr. Huth. Since we've got Tylenol for fever and pain, I would use that in preference to the ibuprofen.
Okay. We had more questions come in. We're just going to kind of keep rolling here for a couple of minutes. We realize that COVID-19 cases are only counted and reported when tested. Can you estimate how many calls you are getting each day where you think the caller has the virus and you're asking them to self-quarantine? What is the trend? Are the numbers of these types of calls increasing?
Well, the trend's up.
Yeah, absolutely. And Reid runs a respiratory clinic. You've interviewed Dr. Bandari, who's running that clinic, and we're looking at expanding that capability. And basically, its purpose is to kind of triage people into high versus low risk for needing more immediate intervention. And there are a significant number of people who come through that triage service that, have symptoms entirely consistent with, but by our criteria don't triage into qualifying for testing. And so, but on the other hand, the symptoms of COVID can be very similar to other viruses that are still circulating in the community, even some similarities to influenza that we still see some of in the community. And so it's a little bit difficult to give a precise percentage of how many of these folks who are not going to the hospital, not being admitted, not being seen in the emergency department, being managed at home, don't get tested. A little bit difficult to say what kind of a percentage, but I think it's there, it's significant, and I would just be, this is a number totally off the top of my head, probably maybe, 10 or 25%. But, that's just me, and that'd be a great question to ask Dr. Bandari, what she thinks. But it's all speculation on anybody's part. All we can say is that from a qualitative standpoint, we think it's real, but it's hard to quantify.
In an epidemic like this, anybody that has symptoms of coronavirus would normally be tested, but we're hampered by the fact that we just simply do not have enough tests available. And so since 80% of the people can be just treated at home with home isolation, we're making the assumption that they have coronavirus, and we're sending these people home. Normally, if on these contacts, if we had readily available tests, we would test the people they were around. We would track this disease much better, but we're kind of hamstrung by the fact that we have these test shortages. This will probably be corrected in the future with more tests and tests that are quicker, but that's what we're working with right now.
You're watching Ask the Doctors on Whitewater Community Television's WGTV Channel 11 and also WCTV Channel 21. We're also streaming live on Facebook. If you have a question for us, you can get into this conversation. We are taking questions on our Facebook page, also on our Twitter feed at WCTV Info. We had some questions come in earlier this week. We've been taking them all week long, so we're getting through them as quickly as we can. Dr. Thomas Huth from Reid Health, Dr. David Jetmore from the Wayne County Health Department with us. Next question up. If I cook or bake something for a friend, could I inadvertently pass on COVID-19? I have no symptoms, and there would be no person-to-person contact in delivering the food.
There's not a lot of documentation of anybody getting coronavirus from something they've eaten. I guess the only thing would be if you had coronavirus and you got virus on the plate or on the food, but I think eating this food itself is perfectly safe. I wish somebody would make me some food and send it over. I'd share it with you, Eric.
Oh, thank you. I like that.
I agree with Dr. Jetmore on that. One thing I think that is fairly much of a consensus in the scientific community is that the virus is pretty heat sensitive. And so most cooking temperatures probably kill the virus pretty readily. So having it in the food is not very likely. And so I've never heard of somebody getting it from something they've eaten. Now, we are concerned about the contact aspect of transmission. And so those who are preparing foods need to observe really good hygiene and sanitary practices around the managing of the food preparation process. And I think you all have been looking at that at food establishments in the county, and everybody's doing a pretty good job.
They are.
Okay. Kind of a long question came in, and some of this may or may not be where you want to go, so I'm going to read part of this and then it'll start to come up. During this pandemic, social distancing, as you all have been preaching, sheltering in place, and essential travel has been invoked in this area. Schools and businesses have closed. COVID-19 cases are slowly on the rise in our community, all needed for our protection. However, shouldn't child visitation and overnights also be temporarily halted until this virus is under control? A parent shouldn't be in contempt for following social distancing and sheltering guidelines, should they? I know you're not lawyers and there may be some legal things in that, but I think they're looking for you maybe to weigh in on, again, with sheltering in place, you're moving people from one household to another, which I think you all are trying to avoid without stepping in the middle of this.
Well, I'm not a lawyer, and this obviously has legal ramifications when you have two parents, each one wanting to spend time with this child who they love very much. I think one of the factors, if one parent lives in Pennsylvania and the other one lives in Indiana, and you're sending them across the country, or one parent lives in New York City, I would be, as a parent, loath to receive or send that child. I suppose if the child, this is a tough question, Tom. I wish you would have jumped in and taken this particular question.
I don't think we ever said this was going to be easy, but you all said ask us anything.
Don't worry about putting your foot in your mouth. I'll jump in and put
all right,
mine in my mouth
save
after
me
you're
if
done.
it gets that far. But I think if the children are in the same town, the parents obviously both love the child and can do everything they can to minimize the child's content going back and forth. I think it would probably be all right. I would be loath to say they couldn't.
Yeah,
Chime
I
in
guess.
here, Tom.
Okay, my turn to put my foot in my mouth then. So I think I hear implicit in the question is a sense of maybe a parent who feels a little judged for maybe deciding not to have like a sleepover for a group of kids from either other parents or something like that. And if that's the case, I would say, you know, any parent who decides that they're not going to have that kind of gathering, we should support because we are trying to limit the sizes of gatherings and so forth. Now, I know that it is on the one hand true that children tend to be least affected by the virus. You know, they don't tend to get as sick as adults do. And severe complications and death are really unusual at the lower age groups that we're talking about for sleepovers and such like. And so I can see some people maybe taking away from that, oh, you know, it's a cold, kids aren't really going to get sick, it's not a big deal, they're fine. Well, they might be. But it's also true that whereas kids may not get very sick, they can still transmit the virus to others. And so that might be, if we think of a children's gathering for whatever reason as a possible transmission point, you know, I think a parent who decides they're not going to do that, they're going to postpone that kind of activity, is making a very justifiable choice. But there could be reasons, to your point, to go ahead with such a thing. Maybe it's a really special occasion. But in that case, what I would suggest...
I was just thinking of an average visitation where the child spends one weekend with one parent.
That we would never want to, you know, get in the way of, because that's going to be, you know, that's not necessarily a bunch of kids getting together. But I think if we're talking about a gathering of children, I think if we're going to go ahead with that, we need to make sure that we're asking any children with symptoms to you know, forbear coming, you know, and that any kid who's there ought to observe good hygiene and sanitary practices, clean hands and such like that.
I agree. I don't think we should have a gathering of children. I was just thinking of this question in terms of sending a child from one parent to another for a visitation.
I don't see that situation as being particularly high risk, do you?
No, so we're in agreement?
We're in agreement.
All righty then.
Okay.
And
I'm told that, and again, this is a community conversation, so people are chiming in. I haven't had a chance to pull it up yet, but I have been told by the voices who come into my head periodically that a lawyer did actually on our Facebook page kind of jump into this also, I think, with some comment. So the person who sent the question might want to go to our Facebook page and take a look at that answer, because there was a lawyer that kind of came into that. So thank you all. Sorry you got caught into that.
what did the lawyers say, Eric?
I haven't had a chance to pull it up. I'll do that while you all go through this next question that I'm going to read. The coronavirus is known to cause pneumonia. Does the pneumonia vaccine help you not get the pneumonia from this?
That's a really good question, and I'll go first, and Dave can jump in. The pneumonia vaccine protects against a number of variants of a particular pneumonia bacterium, the pneumococcus. And pneumococcus is not really a factor in the pneumonia that the COVID-19 patients get. So with that as background, the short answer is having taken the pneumococcal vaccine is not going to be protective against COVID-19 in any way, shape, or form as far as I'm concerned. And the flip side of that is I have gotten the question, should somebody who's sick with COVID-19 wait to take the pneumococcal vaccine? And you could make a case for that if the immune system is not quite up to snuff because you're sick with something, is it smarter to wait to take the pneumococcal vaccine? But actually the CDC have weighed in on this question just in terms of general sickness, should you delay pneumococcal vaccine? And they say no. You should take it when you have the opportunity to. And I would extend that to a COVID-19 patient who qualifies for the pneumococcal vaccine, hasn't had it yet, we would probably try to get it to them just to make sure they got it.
Yeah, I agree with Tom, and as a kind of an addendum to that, there's still a lot of things we don't understand about the pneumonia that these people get. Is this a secondary infection, or is this an immune response of the lung itself that's causing this pneumonia? So there's that to consider.
But we think that right now the thinking is that while there can be super infection, we will call it, of people getting a bacterial infection on top of a viral pneumonitis or the adult respiratory distress syndrome that can happen, really the basic mechanism is a disruption to the air-blood barrier in the lungs, so that fluid leaks out into the lung spaces. That situation is called ARDS, or acute respiratory distress syndrome. And it looks like pneumonia on chest x-ray, but it's not treatable with antibiotic, which is why most of these patients get treated with antibiotic, but that doesn't actually seem to make a difference in their outcomes.
You're watching Ask the Doctors, a community conversation on Whitewater Community Television's WGTV Channel 11 and WCTV Channel 21. We are back now streaming on Facebook. I understand that we lost our Facebook stream for a couple of minutes, but we are back talking with Dr. Thomas Huth of Reid Health, Dr. David Jetmore of the Wayne County Health Department. We had a conversation that kind of led to a legal point. You asked me what the lawyer said.
And you have an answer?
And I have an answer. Amy Noe-Dudas, a lawyer here in town, said
I know Amy. She's a very fine lawyer, so I'm waiting for this answer with bated breath.
Per Wayne County judges, in a press release dated 3/24/20, the Wayne County courts have determined that travel in order to pick up and return children from court-ordered parenting is deemed essential travel for protocols regarding travel restrictions issued by Wayne County. The statewide adopted parenting time guidelines are based on the premise that it is usually in the child's best interest to have frequent, meaningful, and continuing contact with each parent. In the event parenting time is missed due to the COVID-19 pandemic, it shall be made up within a reasonable time as the parties shall mutually agree after the COVID-19 restrictions are lifted. Okay?
All right, that settles that.
That's why we're having this community conversation, so that all of these things can get out. Hopefully that's understood. Thanks for watching this program. We appreciate the questions. We are still taking your questions on our Facebook page. You can also tweet us at WCTV Info. I've turned away from my question page, so Ryan, bring up whatever it is that you have next, and I'll just keep going. If a person is showing some minor symptoms of COVID-19 and they do not have a family physician, should they immediately go to the urgent care or the ER? Or should they call the hospital ahead in deciding what to do? Or should they just quarantine themselves at home and treat the illness with ordinary over-the-counter medication unless their symptoms become severe?
All right, so
where do you want them to go, and what do you want them to do?
Very clearly, we want people to understand that they should not simply pick up and show up at a doctor's office or urgent care or emergency department. We want them to call ahead. Maybe their own doctor's office will take their phone call, and that's fine. But we also provide a hotline, which is available on the Reid webpage, and there is also a triage service available through Reid's app called Reid Health Now. The hotline and the app triage service are both run by nurses who run through an algorithm to help decide, to sort of triage whether someone can safely stay at home, whether they should be seen by a provider, whether they should go to the emergency department or urgent care. But typically what we do is if the nurse feels that they need to have evaluation, we try to have them go to our respiratory clinic. And the whole point of that is to make sure that people with the possibility of COVID don't get into offices and waiting rooms with non-COVID patients and into buildings with unprotected healthcare workers, because they're a contamination risk. And that's a problem for keeping the healthcare system running properly.
Okay. People are seeing a number of things on the internet right now, obviously. And there are a few things that have kind of come out that some of them I've seen in 2 or 3 different posts and incarnations as I've kind of gone through. One starts off, doctors are reporting that they now understand the behavior of the COVID-19 virus. Do you all understand the behavior of the COVID-19 virus?
We're learning some of the behavior. I think this is an ongoing process, but go ahead.
Okay. And they're learning it due to autopsies that they've carried out. The virus is characterized by obstructing respiratory pathways with thick mucus that solidifies and blocks the airways and lungs. They've discovered that in order to apply a medicine, you have to open and unblock the airwaves so that treatment can get there. Here's some things that have been listed that could or can't help, and we're going to kind of let you all jump in and answer some of these. Drink lots of hot liquids. Coffee, soups, teas, warm water. In addition, take a sip of warm water every 20 minutes because this keeps your mouth moist and washes any of the virus that's entered your mouth into your stomach, where your gastric juices will neutralize it before it can get into the lungs. Okay, let's start there. Does any of that sound like, I mean,
Well,
I'm good with tea and coffee. I mean, I drink that all day if I could.
First of all, Eric, I think the description of sort of the pathophysiology, as we would call it in medicine, is maybe kind of at a layman's level, and I'm not sure it adequately describes what's going on from a scientific standpoint in terms of what's happening in the lungs. I mentioned earlier that there's some thought that the virus may be heat sensitive, and so I have seen this recommendation before about drinking warm and hot liquids frequently. And what I can tell you about that is that there's not one bit of scientific evidence behind that being a useful strategy. But on the other hand, there's nothing wrong with it. And if that's what someone wants to do, I don't have a quibble with that.
Okay, it's not going to hurt them.
No.
Okay.
No, but it's not going to help them in any fashion.
Okay. Gargle with an antiseptic and warm water like vinegar or salt or lemon every day if possible.
That will be of no help whatsoever.
Okay. The virus attaches itself to hair and clothes. Any detergent or soap kills it, and you all have mentioned obviously washing your hands, so that's obviously there. But when you get home, don't sit down in your clothes, take them off, take a shower, that type thing. So does it attach itself to hair, clothes, that type thing? Can it be carried in the home that way from what you all have found?
Well, I suppose the answer is yes, it can.
Okay.
But whether everyone needs to go home and strip down and, take a decontamination shower and wash all their clothes immediately and that kind of thing, I think that's a kind of a different question, because there may be people who have jobs where they should consider, taking special precautions when they come home. If I were a firefighter or an EMS or even maybe a policeman, I might be tempted to do that. Is there scientific evidence that that's what they should do? Not really. But I can tell you that if you're a frontline healthcare worker working directly with COVID patients, then I wouldn't leave the hospital building without getting rid of the clothes I was working in, the scrubs I was working in, and taking a decontaminating shower before I left. So that strategy is not without at least some conceptual merit. It's just that I'm not sure that that's going to be that much value added for the typical person on the street who's simply going about their normal business.
Yes, and typically contaminated surfaces where you're going to contact the virus, or you're going to touch with your hands. You're not sitting on a counter. You're not, when you go to open a door, what touches that doorknob? It's your hand, it's not your clothing. I have, my son Thomas is taking care of coronavirus patients in Detroit, and when he comes home from the hospital, he goes down in the basement, takes all his clothes off, and heads to the shower. And because he's got a young wife or got a wife and young baby, and he wants to protect them as much as he can. But that's an extreme circumstance. I think for the rest of us, I don't think we have to worry about that much.
Yeah, I think there is a little bit of scientific evidence for how long the virus may persist on different surfaces.
On porous surfaces, it doesn't last nearly as long as it would on
it's
metal.
not very long. But a hard surface may be quite a bit longer. Some people think a number of days. And so really, I think the value-added steps are to decontaminate high-touch surfaces, wash my hands continuously almost. That's what I do personally. And some of these other things, I don't think that it's not that they can't do anything, but I just don't think they're going to be the really high-value strategies.
Okay, so the next couple that come up probably actually work fairly well for what you're talking about. Wash metallic surfaces very carefully because the virus can stay, this says up to 9 days. I don't know that we know that it's going to be quite that long, but it can stay, as you said, on hard surfaces for a period of time. Take note and be vigilant about touching handrails, doorknobs, etc., and keep these clean at home. Don't smoke. I think you all would say that.
Well,
regardless.
I'm not sure if that has anything to do with coronavirus, but if that's what it takes to get people to stop smoking, yes, stop smoking.
Okay. Wash your hands every 20 minutes with any soap that foams, and do this for 20 seconds.
That's the standard suggestion, yes.
Okay. Every 20 minutes?
Oh, wash.
How often should?
Oh, okay.
Once
How
an
often?
hour.
For 20
Okay.
seconds, I thought you said.
You know,
Yeah,
once-
but 20 seconds is
Yeah.
there for 20
Yeah.
minutes. Wash your hands every 20 minutes for 20 seconds. But
Well, I think I mentioned this last week. I have a reminder at home on my Amazon device to tell me to wash my hands every hour. Now, this is in my home where I come in and I have a little hand washing ritual before I do anything else, but right when I get home. And you can argue, is washing every hour? While I'm in my home, that's already kind of a decontaminated space. Does that really add value? But that's just what I do, and I can't say I'm particularly religious about getting up and actually washing my hands every hour.
I think the main thing, when you
just
come,
like hearing the
when I'm
voice
out
on
and
the-
at work,
Yeah, when you
I
come
wash my hands
home.
very frequently.
when you come to your house, to your home, when you've been out around these contaminated areas, that's the most important hand wash.
Right.
okay. Animals do not spread the virus to people. It's a person-to-person transmission.
Well, I would rate that one as partially true, probably true, maybe put it that way. I would say we don't know very much about animal reservoirs in terms of, whether that could have any role in spreading. Animals don't seem to get sick from it, but that doesn't mean they can't spread the virus. And there are examples in history of animals that are not symptomatic with infection but can spread viruses. This one we don't really know. And so I wouldn't rule out the possibility that one day it's discovered that there is an animal reservoir that can spread the virus. We do think that it actually originated from an animal reservoir in China, probably some wild animal, and I think you mentioned
A
previously-
pangolin.
Yeah,
Well,
the pangolin.
originally-
I don't even know what that is. What is a
It's
pangolin?
a small Asian anteater. I've got a couple of them at
Okay.
home in a cage. I'll show you after the show. No, that's not really true, Eric, in case you were going to accompany Tom.
No.
But it's resided in, there's all of these COVID-19, all of these coronaviruses, the SARS, the MERS,
Right.
they all originated in bats. And then in the case of the SARS, they went from bats to civet cats to people. I've got a civet cat next to the cage that's got the pangolin. And then
I think Murray-
Are you charging admission to the zoo?
I may.
MERS had an intermediate platform
Camel.
in camels.
Camels.
So,
But you know what? I don't think, for the person that wrote that, I would not stop petting my cat or dog or riding my horse.
Okay. I'm not traveling that road with you. I'm not going to do it. I'm not going to get, maybe next week, if you all decide to come back, we'll let you go through your animal menagerie.
I may come back just to do that, Eric.
Okay. If you feel any discomfort in your throat or a sore throat coming on, attack it immediately using some of the above methods. The virus enters the system through the throat, but it will sit in the throat for 3 to 4 days before it passes into your lungs.
well,
Tom is aching to answer this question, so I will defer to him.
I don't think that's not probably a very scientifically accurate thing to say. I think there can be phases that people go through with their symptoms where they will have, for a period of time, symptoms related to
Their throat.
one part. Yeah, maybe it's in the throat, maybe it's nasal, maybe it's a cough. That there's a phase they go through where that's the predominant symptom. But the mistake might be in thinking that somehow the virus is limited to the throat in that kind of a case. So I would argue that the virus is in the system. When it's in the system, it's in the system. And it's not limited necessarily to any particular part of the body. There's no scientific evidence of that. And consequently, I don't think we can say that treating your sore throat is going to make the virus not attack the rest of you. That doesn't logically follow. So the answer is no, that one doesn't make much sense.
Real quickly, and we've got questions still coming in that want to get answered, but when people say symptoms, what is it that most people that you've had a chance to talk to, what are they feeling first?
You know, I think one thing we're learning about this disease, Dave, I think would agree with this, is it's kind of protean. You know, it has a variety of potential manifestations, particularly early on. I remember our very first case that we dealt with was not somebody in the hospital, but it was somebody who had been seen in one of our clinics. Was an individual who never had a cough, never had shortness of breath, never had a fever. His main symptom was that his taste was gone, and everything tasted bad, so he wasn't eating, and over a course of 2 weeks he lost like 10 pounds in body weight. And then he developed low-grade fevers. You know, so we think of this as an upper respiratory syndrome, but it's not always that way.
It can present in different ways in different people. I think the loss of taste is related to the loss of your sense of smell. About 90% of what we call taste is smell. And that's not unusual in that other flu viruses have caused that in the past, the loss of the sense of smell. 85% of these people will have a fever. A lot of them have a headache, Tom. Have you?
Yes.
They'll complain of a headache.
Actually, that individual did start at very first with a headache. So yeah, we've seen headaches, we've seen the taste of the dysgeusia and anosmia, which are the $10 words for taste and smell loss. We've seen GI symptoms, diarrhea, an upset stomach. Fever occurs at some point in better than 90% of patients, but it's not always constant. And so if you look at the whole course of the illness, fever's always in there somewhere, just about. But on any given day, they don't necessarily have a fever.
Yeah, I agree. And the other thing is these patients feel that what we doctors call malaise, just this tired, worn out, it's hard to lift my arm and leg up feeling that you get when, you know, with a lot of infections.
You're watching Ask the Doctors on Whitewater Community Television's WGTV Channel 11. We're speaking with Dr. David Jetmore, Wayne County Health Officer, Dr. Thomas Huth, Vice President Medical Affairs for Reid Health. We have more questions coming in through social media. So will we be responding anytime soon to the many businesses that are deeming themselves essential but are really not? Seems at this point we should be cracking down. So the many of us staying home and sacrificing to do the right thing is most valuable. There are some businesses out there that are still open that have been deemed, and there is a list provided. I want to say it started with the CDC, but I think each governor, each state can modify that. You all close some businesses. Can you all add to the list beyond what's out there and what's listed as essential, and how is that decided?
Well, I think most of the businesses that we consider essential are businesses that are involved with food. I mean, we all have to eat, so grocery stores, we need pharmacies, so the pharmacies are open. I think the problem happens and why people complain is that maybe they're going to Walmart to get groceries, and while they're there, they decide that they'll get a toy for their child or stock up on cosmetics, which are obviously not essential. And, you know, we'll may have to deal with this. If we may have to ask these owners if they've got a part of their grocery store. Well, the same thing's true of drugstores. You can go into a drugstore and buy ice cream, or you can go into a drugstore and buy greeting cards. Well, the greeting card is not essential. We may ask people to tape off certain parts of the store, but we're fighting other fires right now, and we'll deal with that. I think it's irksome when our citizens look at this and see some businesses have been shut down, and others are seemingly staying open. We try to be as fair as we can, and we try to enforce these laws as well as we can. We're walking a fine line in public health between keeping people safe and letting them get food and some essential services.
Jump in. Anything?
Well, I think, it's, I suppose what you define as, what some people in the community would define as essential service and what's not is a little bit in the eye of the beholder, and I might look at things a little differently if I couldn't go to work and earn my living because my business was closed, and yet somebody who does something that I'm not sure I would think of as essential, they're at work and earning a living. So I understand that motivation, but sometimes we're not really, from our perspective, really aware of what the essential need that somebody else may be engaging in, and so
it
we
may
have
be
to take that
something
into account.
that's not obvious. Like I go to a farm store, and I have to go there to get animal feed for chickens and horses, and of course my pangolin.
Don't start with the pangolin.
But somebody would say, well, why is that store open? It's not essential, and they may not be aware of why the person pretty much has to go there.
Right.
We've just about 10 minutes left. I know we've got at least a couple more questions that we want to try to get through. So what precautions should we take when bringing home groceries before putting them away? And I think there was a doctor on YouTube, I think, that put out a video where he kind of disinfected half his counter and not half his counter. Are there some basic things that people need to be thinking about when they're bringing that in?
What do you think, Dave?
Well, to some degree, I guess it depends on the container. If it's a metal container that somebody's handled and handed it to you, I think it would be prudent to wipe those containers down. I think we can assume that whatever's inside is safe and fine. When I order food, go to a restaurant and place my order, and they bring it out and hand it to me through the passenger window. I bring that home. I discard the paper bag. It's usually in a paper bag. Then I take it out of the styrofoam and put it on plates. Then I discard the styrofoam. Then I wash my hands, and then eat.
And then you enjoy.
You have any thoughts, Tom?
I've seen that YouTube video.
I haven't seen the video.
I was fascinated. It's a guy, I think somewhere in Michigan, who's a family doctor, and he basically set his kitchen up like a clean area in an operating room. You got your used or dirty materials are, and then you got your clean zone. And so he was kind of showing his process of transferring things from the dirty to the clean, and sanitizing the external, packaging and so forth along the way, getting rid of packaging that wasn't necessary. And he showed a whole process for doing that in the sink with vegetables and so forth, cleaning them with soap and water. And I think that's interesting, but I think that's probably a little more than what most people are going to really be able to do. And you could make an argument that it's all not really necessary. I think just some common sense things. Get rid of packaging you don't need. Just get it out of the house, and that's what we've started doing in my house, is just take things out of their packaging, get rid of the packaging right away, store things. We know that the virus can't live forever on surfaces. If you got a can, I'm not sure there's a problem with just simply, it's a can you're not going to use right away. Put it in your cabinet and, just leave it there for several days, and that will probably be adequately decontaminating. So you just have to do some common sense things. But, the big thing is when we're bringing things in the house, we're putting them away, getting rid of packaging, and sanitizing our hands before we move on.
We have one more question that we need to get to right now, and I understand, Dr. Jetmore, this is for you. Why are you, Dr. Jetmore, making funeral guidelines in writing and then differing funeral firms receive verbal variations to your guidelines while other firms do not? Can you here and now state to viewers what are the current guidelines for funeral service? We are simply trying to give families consistent, accurate information. Okay.
Well, I think the basic guideline is, I only remember talking to one funeral director after, on the phone after giving these guidelines, but basically no funeral services and 5 people at the grave site, and they should be spaced out.
Okay.
That's it in a nutshell. Yeah. If there's been any confusion coming from me or my department, I apologize, but I wasn't aware that there was any confusion.
Well, there shouldn't be now. You've cleared it up. We have it on tape. We'll replay it back periodically for you.
All right.
We are probably down to about 6 minutes or so. The voice in my head is going to tell me in a minute. As in the past, Ryan, I'm sorry, I talked to the guy out there. If you can see my computer, can you bring up the screen that's there, please? We went to the state website where, nope, that's where I wanted to go. Okay. We were looking at the numbers for the state, where we currently have 102 deaths in the state. The numbers seem to be climbing. Everybody keeps kind of projecting when this will peak, when this won't. And we'll read what was put on the site as of today real quickly. Positive cases, 3,437. Total deaths, 102. Total tested, 17,835. That's for the entire state. So we have yet in this state even tested we haven't even tested the population of Richmond at this point, which is kind of a scary figure. Talk about where you all see those numbers going. Are we here in Wayne County, and our numbers are not that high, particularly when you compare them to some other places in the state? Are we bending that curve enough? Is there more that needs to be done? Do you see this needing to harsher restrictions being put into place to kind of get this under control? What do you see here as you look in your crystal ball?
Well, on the one hand, I think the state officials are still saying they're thinking that the peak will be somewhere between about mid-April and mid-May, roughly, and that's based on computerized mathematical projections, and you can come up with different scenarios depending on the inputs that you put in. But probably that's generally correct. We're certainly seeing increasing numbers at Reid, kind of in line with that. Now, having said that, what you have to realize, Eric, is that the sick people that we're seeing today, they actually got sick a couple weeks ago.
Right.
So there's this lag, there's this time delay. And so how long have we had the restrictions in place? It's been about 2 weeks or less, really. And so we need more time for the impact of the restrictions to really be seen in the numbers, is my view. We shouldn't draw too many conclusions today over what's been done over the last week or 2 weeks, because what we're seeing today was what was happening 2 or 3 weeks ago, and we need more time to see the impact.
I agree. We're not seeing what's happening today, and we don't have enough testing to really give us even more information. In areas where this has gotten out of control, like Italy and Spain and New York City, these cases are on such a steep curve that they double every 3 days, which is an amazing statistic. You don't have to be a mathematician to realize how terrible and how greatly these numbers grow over such a short period of time. We're not in that period, but I do think the restrictions we have are bearing fruit, and a lot of it, we can ask people to do this, but it's really up to our citizens, and they've done it. I mean, they have stepped up to the plate. People have stayed home. People have distanced themselves. And I think when I go to the grocery store, I think people are cognizant of this. You don't see people grouping at the counter. They're waiting behind the 6-foot line. And so I think this is bearing fruit. But like Dr. Huth says, the disease we're seeing today, those people were infected a couple weeks ago.
We've got one more. We're under 3 minutes, so we're going to ask that the answers be short. While we are in this stay-at-home order, we are allowed to drive to Middle Fork local parks, get out. Obviously, this is supposed to be a really good weekend, 60, 65 degrees, maybe even 70 earlier in the week. People are wondering, what can they do?
Well, I think they should go there and not sit in their car. I think they should get out and walk around, and if you've got access to a woods, you should walk in that woods. If you, still the main thing is social distancing. I think it's good for your body and soul to get outside, and any of these parks that are open. Now, there's a difference between walking around in a grassy field and getting together with 10 of your buddies and playing basketball at the park. We don't want that to happen, but the whole idea is to not transmit this virus. And if you can enjoy the outdoors and do that without infecting others, then you should do it, especially with the weather getting warmer.
Anything you want to add?
I mean, pretty much Dr. Jetmore said it, and we just have to be commonsensical about where we're going and what the circumstances are. But yeah, I plan to get outside of my house and do something outside this weekend. And am I going to get in the car and go to a concert or to a play? No, partly because I can't. There aren't any, but also partly because I wouldn't do that under the circumstances. And so we just have to apply common sense. This is not about staying at home as much as it is as not avoiding contact with other people during this critical time period.
Okay. Dr. Thomas Huth, Vice President, Medical Affairs, Reid Health. Dr. David Jetmore, Wayne County Health Officer. Thank you both again for being here. Are we doing this next week?
I'm game if you are, Dave.
I'm game if Eric will have us back.
Why not?
It's
all
always
right,
You might want to check his
week.
comments before he
We'll
commits.
be here. Thank you all very much for watching this week's Ask the Doctors, a community conversation. We'll have this in replay. I wish you well. Enjoy your weekend.